Hi everyone, welcome back to part 2 of this month's Clinically Speaking episode. I'm Dr. Anushka Patchava, the Deputy Chief Medical Officer at Vitality, and today I've got Rob Stephenson, the founder of the InsideOut LeaderBoard, joining me. In this video, we'll be carrying on the conversation around mental health and the return to work. Here's what we covered in part 1 of our mental health and the return to work episode.
As a campaigner passionate about inspiring the creation of mentally healthy workplaces, I've had to really kind of flip what I do in the last 12 months. I think the great opportunity is to focus on preventing people from falling ill or promoting a positive well-being of mental health. I think it's an opportunity to really accelerate the mental health agenda in the workplace as we travel through the pandemic to the next normal. I've personally seen organisations go from doing not much to doing quite a lot, and I've seen organisations go from doing a good amount to doing a great amount.
We've tagged the video in the description below if you'd like to view it again. Thanks, as always, for tuning in to Clinically Speaking. We hope you enjoy the video.
You mentioned that there's some good places, good workplaces and not so good workplaces. I want to dig a little bit deeper into that. So let's put ourselves in the employer's shoes. What are the top 5 things an employer can be doing right now to enable and empower their workforce towards, better mental well-being?
Yeah, good question. So I think good practice for me right now, specific to the circumstances we're facing, involves really finding a way to check in with colleagues, because we're still in lockdown for the most part. People are working remotely for the most part. How do we know how our employers are doing? Yes, pulse surveys will tell us something, but we need to find a way of really checking in with colleagues to be able to answer that question, how are you today, in respect of your well-being and mental health, and create that sort of safe space for people to answer it. And finding out what people need. Now, form score is one way that people can check in. That's my solution to that. But I think we've got to put effort into asking our people how they're doing. And I think we've seen some good practice in that. I think more organizations need to make sure that we're properly checking in with people. So I think that's the first one. I think, secondly, we need to kind of help people connect with colleagues in a better way. And I think this will apply us to when we move to kind of any remote hybrid models that we start working at. But right now, the biggest thing that has been eroded is the social connections, those impromptu conversations that we have around the water cooler, to use a cliche, the lunches with colleagues, the cup of coffee, or just the opportunity to turn to the person next to you and vent when you've had a really difficult call or difficult meeting. And so we need to really work on creating moments of connection that is not necessarily about what's going on from a business perspective. So providing informal opportunities to catch up, having buddy systems where people can catch up with each other, that's not about their jobs, but it's more about how they're doing, that kind of stuff. So I think those things are really important. I think the other really interesting thing right now is that we're starting to see that well-being is a really personal thing. Some people like going to the gym and get benefit from that. Others people, would enjoy using Headspace and would get benefit from meditating. But they're about 40% of any given population. Other people might need to go and join a book club, or do some good in the community, or work on their financial wellness. So I think thinking about a holistic benefit strategy for employees is really important, and one that can be accessed remotely. So a lot of content and initiatives have previously been about physically being in the office. We now need to access them from wherever we are, and making that availability of choice, I think, is really important. So I think those are probably 3 things. The fourth one for me, I think it's been shown that we're not very good at human beings at being disciplined and intentional about our well-being. And the physical workplace actually gave us some really good things that would benefit well-being. Little breaks to go from a meeting room back to your desk, stepping outside to go and get your lunch. The dreaded commute. I mean, we'd all moan about the commute, right? But what it did, it provided this buffer between home and work. So again, as people are working remotely and people continue to work remotely for more of their time, it's, I think, educating people and equipping people to better manage their well-being when working remotely. So encouraging people to put those breaks in, maybe even doing that in the diary, you know, making sure people understand the benefits of taking a lunch break away from where you're doing your work, the rituals of shutting down at the end of the day. So I think that's really important as well. And I think, you know, digital technologies are going to be important for organizations to adapt, to help with all of that. And then the final one for me, it's always close to my heart, this is leadership engagement in mental health and well-being. Leaders have this unique opportunity to create permission for people in their organization to prioritize their well-being. So if your CEO is role modeling healthy behaviors where it comes to, you know, well-being, taking holidays, talking about the good sleep that they've got, prioritizing exercise, that creates a culture where people feel empowered and equipped to prioritize their well-being. So I think leadership teams have a role to play in helping create that really good behavior. There's 5, I think.
There are 5, and thank you, Rob, for sharing those valuable insights. There's one I definitely wanted to pick up on, and it's something very close to my field and my heart. I've noticed that in a recent employee engagement survey, you know, a global one, 98% of employees and employers really do prioritize and care about the mental health, or at least they say they do. They say it's, you know, their top agenda item. It's what they really care about. And out of the organizations that were surveyed, a further nearly 50% said that digital apps was the way forward. And I just wanted to, I guess, pick your thoughts on that. I know for me, you know, I'm definitely fatigued on Zoom and Teams and the digital environment. So how can we break down the social connections, bring us closer together through the digital apps and the digital environment without causing, as you say, the burnout and the fatigue and the over screen time, which has a significant impact, of course, on physical as well as mental health and sleep and such likes. What would you say to that? How can we break down those barriers?
Yeah, it's a good question. And I think digital apps have a place in an integrated wellbeing strategy. They're not the panacea and they're not the sole solution. And I think if we are just buying an app for our employees and thinking we've done mental health, then we're seriously misguided. It's the same with mental health first aid or any one-stop solution. We need an integrated strategy. So that's the first thing I'd say. I think the second thing about digital is to be very clear on what you're trying to do with it, and where it fits in with that overall strategy. So, you know, I think it's great if we supply things like Headspace if we want to make sure that we're giving people a solution for mindfulness and meditation. Now, as I say, that will only appeal to a certain percentage of people, which is great. What about everybody else, and what are we applying to them? And you know, there's again the danger is if it's a kind of one-stop solution that we think we've solved everything. I think the power of digital apps is obviously the scalability, but I think also if an app can then provide data with consent of the employee that can help direct the wellbeing strategy to be more personalized and more effective, then I think that's the real role for digital. So I think collecting data on how our people are doing from a digital app point of view or a digital solution is important. But you're right, there is this mentality and this feeling about not another app, right? We've all got more apps than we use. And as somebody that's just launched an app, I'm very cognizant of this. You know, so for me, what we're trying to do with FormScore is make something that is really light from a user time perspective. So to put your score in each day can take 30 seconds. But actually the digital app is then trying to facilitate connections that occur outside of the app. So, for example, I can give you a real case study on this. A HR director friend of mine who is connected to a CEO friend of mine on FormScore. The HR director was trending down. I put a 4 out of 10. The CEO knows him, gave him a call actually, and they arranged to meet up for a distant dog walk in London. So this is an example of digital facilitating a physical and human connection. And I think for me that digital only solutions, they have their part, but we want them to do a bit more, and we need to make it really easy for users. But I think there are some great digital solutions out there, but it's just trying to make sure they fit into an integrated strategy, and we actually know why we're using that particular app as part of that strategy is important.
Thank you, Rob. And I guess for our audience, they're advisors, they're brokers, they're working in business in the new normal. What would you say would be great insights for them to know, for them to be aware of how employers are reacting to the shift in the importance of mental health in the workspace, and perhaps some advice for the brokers, advisors and intermediaries themselves who may be experiencing the challenges that we all are with COVID-19 and the impact it's had on mental health and well-being?
Yeah, thank you. I mean, it's a good question. So I think, for your brokers, intermediaries and advisors, I think it's really important that actually we kind of put our own oxygen masks on first, because they'll often be dealing with clients who are coming out with issues and particularly where we're giving advice around financial wellness and products that some other stuff can be coming out there. So I think to have the resilience and reserves to be able to have those conversations, I think make sure we're prioritizing our own well-being first. So do the things that keep you well, get your exercise, sleep well, prioritize some breaks in the day, take your holidays, all of the good stuff is important. I think one skill that's quite useful, which a number of your clients will have anyway, is this non-judgmental listening skill. So I think there's a great free course actually from the Samaritans called Wellbeing in the Workplace that's all around bringing some of the listening skills of the Samaritans into the workplace. And I think building up that skill set could be quite helpful. But I think more generally, it's about making sure in your own workplace, you're prioritizing the sort of well-being and mental health of employees. And you role modeling healthy behaviors, both with clients and with internally is a really good one, because you then start to create these cultures of well-being that people feel inspired and equipped to also prioritize their own well-being. So I think, even talking about a good night's sleep can then inspire somebody you're talking to go and think, yeah, actually, I'm going to try and get a bit better sleep tonight because that person is feeling great. So it's trying to make well-being infectious and create a kind of collective resilience against poor mental health, actually.
Great. And that's something that I wanted to end our conversation with, and that is around the new normal that everyone keeps talking about. And what will the return to work process look like? What will the new normal feel like? Based on your conversations in the ecosystem with employers, with employees, with friends, with colleagues, could you shed some light on what the new normal and return to work could look like, and perhaps some examples from where you believe organizations are offering the right solution to help people get back to that state? That would be very, very useful for us.
Yeah, sure. And it's a big question, isn't it, that one? So let's start with what the new normal will look like. And I think we'll see a range of this, but I think looking at it through an optimistic lens, the new normal will be one where people are treated as adults, where we're trusted to do the jobs that we can do because we've shown we can do them under our own steam without somebody looking over our shoulder. And that empowers people then to construct their lives in a way that gives them more flexibility to do the things that give them pleasure and keep them well, seeing their family, putting their children to bed. So I will give a more realistic view as I go along, but this is a very positive view that this is how I think it should be. So we're empowering our employees to do their jobs. So what does that leave the workplace as? So for me, we would typically go to the workplace in most cases because it was 8:30 on a Monday morning, and we'd stay there for our allotted time, and we'd do our deep work there and everything else. For me, I hope the world moves to the point where the workplace is somewhere we go because something is happening to draw us there. It's an event. It's magnificent. It's marvelous. It's collaboration with colleagues. It's connecting with colleagues. It's the great pitch. It's the let's get together and solve a problem. But we're not just sitting in an open plan environment with headphones on, knocking out our deep work, because that's probably not the most efficient place for us to do that. And we could do that and put our children to bed. So that's my hope, is that this hybrid work model is actually not just we agree that we're going to be in town for 3 days a week and these are the days. No, we're going to be in town when there's a need to be in town because something great is happening. Now, for me, that gets me, yeah, purposeful, and it's intentional. So that gets me quite excited about that. I think, so if you start thinking about that, I think there's probably a bit of anxiety with people not knowing what the future holds for them in terms of how they're going to be working. So I really like the bold statement of Nationwide, for example, of saying, right, you know, people can work where they want, however they want, whatever it was, but we need to create certainty for our employees so we know where they stand, and they can then adjust from where we're at now to what the future will hold. I think that's important. So communication, leadership teams on the front foot, being vulnerable, sharing how it is with clear guidelines on what's going to happen next is important. I think this idea of psychological safety, or people feeling psychologically unsafe as we travel back into the big wide world, is important. And I think we need to give our employees time to adjust. It's almost like we need a phased return to the workplace, whatever the workplace ends up being. And actually, some people will need to take it easy. There's going to be a lot of health anxiety for people. There's going to be a lot of uncertainty. I mean, some people will be loving it and it's where they want to be. Others will need to be taking their time to do it. And as employers, I think we need to be very mindful, very supportive of that, and helping people deal with that trauma almost of what we're leaving behind and what we're moving back to. As I've mentioned, I think there's an important part of equipping people to better proactively manage their own well-being, that prevention promotion idea in the context of the new way of working, particularly if we're going to be at home more. And I think there's going to be a real need for better check-in procedures of how people are doing as we're not seeing them as frequently. But I think this is a great opportunity to reimagine the way of working in a way that is more human, in a way that is more conducive to people having a balance of life, work, hobbies, children, family, all of the aspects that keep us well and give us a bit more time to do that. Or we could try and go back to how we were working before. And, you know, for me, certain organizations will do that. A lot of people will ultimately walk with their feet because they don't want to be back to the way things were before. As the world becomes more secure in the job market, et cetera, et cetera. And I think organizations have got to show, in my opinion, a degree of flexibility in allowing people to work in different ways and finding ways to work more effectively and collaborate better in the new kind of way of putting it all together. So I think, you know, we're at the start of seeing the response to organizations. Some will let people do, you know, kind of whatever they want. Others are going to be more prescriptive. I think we need to show more trust, talk to employees and help them along that journey a little bit.
Great, thank you, Rob. That's very, very insightful for us and our audience and our members. I think my key takeaways are: be authentic, don't hesitate to talk and speak out if you are struggling right now. It's let's destigmatize the stigma attached to mental health and mental well-being. Ironically, and unashamedly, our Vitality mental health and mental well-being services are called talking therapies. So really, you know, enabling that talking element and being able to communicate and open up the conversation. And I guess the third takeaway I have is be prepared for what the new normal is, and you know, be able to make your own decisions and have the choice that we hope employers will put in front of all of us going forwards into you know, the rest of this year and beyond. Yeah. Rob, thank you so much for sharing your insights. You look like you were going to say your last thing, so I'm going to give you the
Thank you. I think, you know, hearing you talk there, I think for me, there's a sense of, if we can treat this both as individuals and employers with a sense of curiosity to see how things might be, a sense of lightness, a bit of trial and error, I think we can really move to a place that could be quite wonderful. Again, talking through an optimistic lens, but as you were talking there, the word that was coming to mind was this sense of curiosity.
I love that, and that's a great note to end on. Thank you, Rob, for your positivity, for your honesty, and for sharing your journey and your experiences. Hugely, hugely valuable. I'll finish by asking you a very kind of trialing question. What would it take to get your form score up from a 6 to a 7 or an 8 or a 9 or a 10?
So actually, what I should say is that as a result of having a chat, my form score has definitely already gone up to a 7 from chatting to you. So that's job number one. I think for me, a good night's sleep will probably get me up to an 8. I haven't slept very well for 2 nights, and sleep is a big driver. Longer term, for me, I need to work on my recovery from long COVID challenges. So it's actually being a bit more intentional about kind of making sure I'm doing all of the right things to give myself the best chance to get exercising again more regularly. And exercise is a big way that I stay well. But this chat has taken me up to a 7. So thank you for that, Anushka.
Fantastic. Great to see you again, Rob. And thank you for giving me the perfect segue to our next Clinically Speaking episode, which will be on long COVID and a discussion around that. So that's it from us today from the Clinically Speaking team. I've been Anushka Patchava. Thank you for joining us, and thank you, Rob Stephenson, for providing a great conversation.
Thanks, everyone. Thanks for having me.